Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. Last week, a new variant of the coronavirus was detected in the United Kingdom. This new variant has been associated with the recent rise in cases in England and is supposed to be more easily transmissible. After it was detected, Prime Minister Boris Johnson imposed a stringent lockdown in the UK, and several countries, including India, imposed travel restrictions. India, for example, has temporarily suspended all flights from the UK till the 31st of December. Now, this new variant is, of course, caused by a mutation in the virus. A mutation means a change in the genetic sequence of the virus. All viruses mutate. And so, this virus, the SARS CoV-2, has mutated several times in the past as well. But this new variant now has people worried about whether it will cause a more severe form of COVID 19 and whether the current vaccines will still work against it. To answer these questions and to know more about this variant, in this episode we talked to Dr. Shahid Jameel, who is one of India's top virologists. Dr. Jameel, authorities and governments around the world are now concerned about this new strain of coronavirus that has been identified in the UK. Could you talk about what we know about this new strain and in what way do we understand it to be different from, the strain that we have been dealing with?
Right. So, firstly, let's get the terminology straight. Technically, it's not a new strain, it's a new variant, or we can call it a new isolate. You call a new strain when it has a different phenotype. This doesn't. Uh, Phenotype means a fundamental property of the virus. The virus still has the same property, it's still transmitting the same way. It may be transmitting a little faster, but that's not enough to call it a different strain. It's just a different variant or a different isolate. Now, when we talk about this new variant, this is for the first time that two different changes in the viral spike protein at the same time. And these two changes are making the virus isolate or the viral variant to spread much better in the population. What has been seen is that these changes allow the virus to enter cells more efficiently. And if it enters cells more efficiently, it can multiply to higher numbers and it can go from an infected person to an uninfected person more readily. And that is something that we call more transmissible virus. But there is no evidence so far that the disease that it causes is any milder or any more severe than what we had seen all this time. So, yes, it's a viral variant that is spreading more quickly in the population, but it is not something that is causing disease that is any worse than what we have seen so far.
And do we understand just how much more transmissible this new variant is?
Well, that's hard to say. I have seen figures of 70% more transmissible, but I think that is based on really very loose science at this point. So I wouldn't say whether it's 50% more or 70% more or 100% more. And I don't think that's the issue. The issue is that it is transmitting more efficiently. And if we don't take all the precautions, then it will simply spread further. So we need to do whatever we are being asked to do earlier, like maintaining distance, wearing masks, and all of that. All that will control this one as well. And this is something very natural that happens in viruses. Mutations happen. Some of those mutations allow viruses to infect better. Some of them allow viruses to cause more severe disease. Others cause viruses to cause milder disease. All that happens. So this is not something very unusual that we are seeing.
And I'll get to this point a bit later, but there are just like couple of more concerns that people had around this variant. One, you've already addressed that, there's nothing to show that it causes any more severe form of COVID-19 or not. The other worry that, people have about this is whether the Pfizer and Moderna vaccine will still work against this. How concerned should people be about that?
I have no concern about that because whether it's the Pfizer vaccine or the Moderna vaccine, or for that matter, any other vaccine that is being made today, all the vaccines are based on at least the full spike protein of the virus. This is a little change that has happened at 2 points in that protein. Yes, it's making the virus getting into cells better, but the human immune system doesn't make antibodies or doesn't make T cells against a particular point in a protein. It makes these responses to surfaces of proteins. And in that surface, you have a little point that has changed. So I don't think this is going to make any difference to the vaccines that are being built.
And will the current tests that we have, like the RT-PCR tests, will they still be able to detect this variant then?
Yes, absolutely. Again, as I said, it's a single change. The single change does not make enough of a change in the gene which you detect with PCR. And also, the change is not in a region against which you make what we call primers to be able to detect the gene. Point number two is that in the RT-PCR test, you don't detect a single gene. You don't detect just the spike gene, for example. You detect at least three different genes from the virus. So I have no worries that we will not be able to detect this variant.
And, like you mentioned, viruses, in general mutate. And this isn't the first time that even this virus, has mutated. Why do you think this particular variant is, making a lot more news?
Well, I think for a couple of reasons. One is that we are in the middle of a pandemic. Everyone is anxious. Too much hope is pinned on a vaccine to be able to get us out of this pandemic. And any new thing is causing anxiety. Beyond that, it's the information network that spreads any news like wildfire. I think news is spreading faster than the virus. So all this is really causing concern, but I can assure it's not a reason to be panicking. There is reason to worry, but there's no reason to panic.
And considering the virus, this is a new variant, that was first detected in the UK. And considering the virus is mutating like everywhere, is it possible that India itself might have a new mutation or new variant that we don't already know about?
Oh, yes, certainly. India has the world's second highest number of confirmed COVID cases. It would be foolish to think that we may not have this variant or any other variants. Of course, we have variants. We have many variants, and people have been sequencing in India, and we have been finding, in fact, a unique variant was found in India, which was given a different name. So all that is happening. Just this particular virus we have not yet found, but that doesn't mean it's not there. It could simply be there, transmitting at a low level, and we haven't found it. What I did find in the sequence database from India was that one of these mutations is already seen and mapped in India, but both mutations on the same virus have not yet been seen. But if we increase surveillance, genomic surveillance, we will not catch it by simply doing RT-PCR. If we increase genomic surveillance, we might be able to find this already in the country. It doesn't have to come from outside. It could very well be developing within the country. The situation, conditions in UK were not anything special that this virus arose there. It could might as well have arisen here as also. But not being able to find doesn't mean it's not there.
And do we know about whether, these different mutations, these different variants, react differently in different populations?
Sometimes they could. We don't know for the COVID virus as such. And that's simply because not enough work has happened. We are in the middle of a pandemic. So sometimes it becomes very difficult to link a particular genomic sequence or a variant with the type of disease it's causing. And this would have to be done in many patients and with many sequences before you can confirm. But it's entirely possible viral mutations can cause more disease or less disease. There have also been instances with other viruses where mutations have made the virus infect some organs better than others, some tissues better than others. So, this kind of variation is very normal for viruses. This is nothing unusual for this virus.
And, right now, governments in Europe and in India, they have put in several travel restrictions to and from UK. What do we know about whether these travel restrictions, do you think they will help keep this strain away?
Well, travel restrictions from an area where this is spreading very widely will certainly help limit the introduction of the virus into other settings, other countries. But there is no way to say that such a variant will not emerge from within. And that's what I was saying earlier that India has the second highest numbers of cases globally. It is entirely possible that this variant has already developed and is circulating at low levels in the country, and we have not been able to catch it yet. So, you will be able to catch it if you do genomic surveillance at a reasonable density. The WHO recommends that after every 300 positives, you sequence one, and that they believe will be sufficient to statistically cover the population. In India, unfortunately, our genomic sequencing is one after every 3,000 cases, roughly. So we are actually doing genomic surveillance 10 times less than what WHO recommends. And this is something that we now need to speed up because as we roll out vaccines, we will see other viral variants emerge in response to the vaccine. So it is best to catch those early and put in measures. All this has happened with other viruses. It will happen with this virus also.
So this new variant, you said we shouldn't be that concerned about, and you mentioned that the measures when it comes to basic hygiene and social distancing, those will obviously still have to continue, and even more so. Rather, I was just wondering, as a virologist, being in the middle of the pandemic, hearing all this, what is the thing that worries you at this point?
What worries me at this point is the amount of ignorance and people falling prey to all kinds of false news and simply panicking but not following what is scientifically proven to work. It's been scientifically proven that if everyone wears a mask, you can drastically cut down transmission of this virus. This variant or that variant doesn't make any difference. The virus. And I don't see people following that, whether it's COVID fatigue or whatever it may be. Today, your best protection against the virus is to simply follow precautions that we have been saying for the last 10, 12 months. Wear a mask, avoid crowded places if you can. And if you have to go there, maintain distance and practice proper hand hygiene. If we just follow these three precautions, we should not be worried about this variant or that variant. And mind you, even after a vaccine comes, if we think that we can get away from masks, it would be our foolishness. We should continue to practice masking for at least till the time the WHO declares that this pandemic is over. So just follow basic precautions and not be overly concerned about everything that you hear on the news or everything that you see come through, forwarded message on your WhatsApp or whatever.
Is there anything you think that the government can do to perhaps, spread this message a lot better and make people more aware?
I think the government at this level is doing enough. What the government needs to do is to be more transparent in its decision making, because transparency brings in the element of trust. Why are so many people concerned about vaccines? I mean, India doesn't have an anti vaxxer movement. Or why are so many people concerned about vaccines? Because A, they don't understand how vaccines are made. And suddenly they're thinking, how come a vaccine is being made in 12 months, which used to take 5 to 10 years to make? So there is this natural instinct to be suspicious. And I think the best thing any government can do is to be transparent, show what science is all about. Science often has doubts, and there is nothing wrong with that. But it's very, very important to communicate clearly and transparently so that we build trust. And if there's one thing I would ask my government to do, or any government to do, is to build trust in the population by not just words, but also actions.
Dear listeners, before we move on to the rest of the show, I just wanted your quick attention. One of the big reasons people say they like this show is because it helps them understand the news better. It provides them with the context they need to see the bigger picture. And there is perhaps no other place that does that better than Indian Express's Explained section. We on Three Things refer to the section regularly, and it helps us make this show. If you're a regular reader of Indian Express, you know how useful the Explained section can be, especially when you're looking for in-depth analysis by the right experts. You can log on to indianexpress.com/explained and access the coverage 24/7. Explained by Indian Express, where news that matters is explained by experts who know the subject. Now, back to the show. Now, in the view of this new coronavirus variant from the UK, the Health Ministry yesterday issued a new standard operating procedure for passengers who have travelled from or transited through the UK in the past 4 weeks. Requirements issued by the centre include compulsory RT-PCR tests on arrival, separate isolation for those testing positive for the new variant of the coronavirus, and institutional quarantine for co-passengers of those testing positive. In a routine press briefing, Niti Aayog's Dr. V.K. Paul said there was no cause for concern over the new strain. He said that this mutation is not affecting the severity of the disease, and case fatality is not affected by this mutation. Also, amid these concerns, Reuters reported that 3 people arriving in India from Britain tested positive for the coronavirus, but it wasn't clear if they had been infected by the new strain of the virus. You were listening to Three Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargav, and as always was edited and mixed by our producer, Joshua Thomas. Before we go, here's another reminder to check out Indian Express's Explain section. You can log on to indianexpress.com/explain and find in-depth analysis by the right experts. It has everything you need to know to understand the news better and see the bigger picture. If you like this show, then you can subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcast@indianexpress.com.